Numbers being closely watched by Ballad Health Chief Infection Prevention Officer Jamie Swift, who joins us again for a quick update on cases tonight. Jamie, thank you very much for joining us. Your reaction to the numbers as released by Ballad today?
Obviously there's an increase there, and so we're very concerned. We have seen our cases continue to increase, and following those cases come hospitalizations. So we do continue to expect to continue on this upward trajectory until we can slow things down.
And with that, we know from what we've learned over the past year and a half that as hospitalization numbers increase, typically we begin to see an increase in the number of deaths. Are you bracing for what we haven't seen yet, which is a big uptick in the number of people dying?
We hope we can keep those deaths to a minimum. I do think we'll see an increase in deaths, unfortunately. I think we have some treatments and some knowledge about COVID that maybe we didn't have a year ago. Also, we're hoping that as these cases seem to be a bit younger right now, that maybe we do have a little bit better response, but I am concerned that we'll continue to see an increase in deaths.
That's interesting. We've learned a lot in a year and a half, including how to treat COVID patients. You mentioned you're hopeful that maybe will make a difference for some in this COVID surge?
I hope so. There's a lot that we've learned about COVID. Unfortunately, there's a lot that we've learned about Delta. And so with Delta, we're seeing that it is much easier to spread. And so that's really the concern of the region right now, is just how easy this virus spreads and what we need to do to stop it.
Last week, Ballad said you were bracing for, and you used the words, a catastrophe in which you would have more patients than you had capacity. Is that still the case tonight?
It is. I think if you sit back and watch the regions of the state that are a little bit ahead of us, the other states that are certainly experiencing that increased capacity, that having to find hospital beds for patients up to 150 to 200 miles away, based on our trajectory of positives, we have to believe we could be headed there. And so that's why we've come out so hard and so strong with our messaging to really try to implement measures to slow this virus down before that happens here. Because if it does happen, then we're going to be in the exact same place these other cities are right now.
Last week as well, we were hearing that upwards of 90%, even closer to 95% of the people in your hospital sick with COVID had not been vaccinated or had not been fully vaccinated. What's the latest on that tonight?
That is still the case. We run anywhere at any given time between 90 to 95, up to 97% of our admissions with COVID are not vaccinated against COVID.
So the message is the vaccine works against this variant of COVID-19, but we're hearing of people who are coming down with it and it's just mild symptoms, very much mild symptoms. That must be a relief, but also a concern in that I would think that they could be functional, out moving around. They're not needing to be hospitalized, thank God, but they could be spreaders. Is that the case?
It is the case. It's very much relief, and it is very much the vaccine doing exactly what we said the vaccine would do, and that is keep people from severe illness, from hospitalization and death. If you look at any vaccine that we have, no vaccine is going to prevent 100% of infections. It ties right in because we now know that with Delta, that even our vaccinated people can spread. That is exactly why we have the recommendations to mask inside again, because we know that those vaccinated people may have very mild illness, may not have symptoms at all, but they can still spread. And so that's why masking is so very important right now.
You're speaking to, I think, what seems to be the debate people are really having about the vaccine as well, but also the fact that vaccinated people, according to the CDC and to Ballad and to you, should be masking up. That's hard for some people to take, The vaccine was their way out from having to wear the mask. What would you say to some tonight who are going, you know what, listen, I did it all. I'm not doing this. I'm not masking back up.
We understand. We hear you. I certainly don't want to be in a mask either. But unfortunately, this virus has changed and the ball game has almost started over. And so we have got to do all we can to stop this spread and to stop it now. The fastest way to really stop spread immediately is to mask up. We can really limit transmission. The strongest way is to vaccinate. So while we're masking up, if you've not been vaccinated, please go get your vaccine. masking with vaccine, we can slow this down. We can prevent future variants. And that if we allow this virus to continue to spread and spread and spread, it's going to continue to mutate. And we're going to be back here over and over and over. So really just encourage people, take the measures now. This is our chance. Let's take the measures. Let's all come together. Let's stop this in our community and move forward.
All right, Jamie Swift with Ballad Health tonight. Our very best to you and your team there as you're again responding to another surge. We thank you so much for your time as always.